Hi, guys. Welcome to another episode in the Conversations with Shelly series where I take you beyond the ordinary. Now, today's topic is something that is very important for us to understand. And the reason why I thought it important for us to understand this week's topic or this week's episode is because a lot of us that are within the GLP-1 community may be doing this not realizing that there are other implications to being obese and being diabetic or having heart conditions or kidney conditions or other chronic and progressive diseases as the case may be. And what we may have um, already considered our minds or ourselves to is just how to get these medications at a lower cost, either via some methods or means, or via our own independent out of pocket, or via Medicare or Medicaid or any other of the other insurance companies or insurance policies that are within our space and within our jurisdiction. But something happened recently, I believe it was yesterday, which would have been November the 7th, 2025, that I thought was very much of a telltale sign as to something else that we may need to consider. And the reason why I wanted to stop here first for us to start to have it as part of our community conversation is because it now affects us in a different kind of a way. And us, I mean persons who have these chronic and progressive disease. So, hi again, everyone. I'm Shelly. And for those of you who are joining me for the first time, thank you so much for joining. And for those of you who are not so unfamiliar with this space, welcome back. So, today I want to dive into something that might surprise you. I don't know whether or not it will or it won't, but if it does surprise you, it did surprise me equally. Well, today particularly, I wanted to bring to you the fact that the United States is now looking at obesity and diabetes and other chronic conditions when you are looking at your immigration status or some form of immigrant or visa application process. Now, you may wonder, why is this important to GLP? And GLP medications like Mounjaro or Zepbound or Wegovy or Ozempic. Now, the reason it is important is because these medications will now become very critical for us with our obesity status or our blood glucose status, so as to allow us to control these progressive and chronic diseases, so as to not be prejudiced by this new policy that is being considered or contemplated when it comes to visa applications or immigration status. Now, a lot of multiple news outlets between the 6th and 7th of November 2025 has released that the United States Department issued a cable to US embassies and consulates directing their US officers to evaluate not only communicable diseases, as was historically the case, but now they are also to consider chronic conditions that trouble us within this GLP-1 space. So it is important, therefore, for us, at the very least, to start to understand the implications and ramifications of having these chronic conditions when it comes to either trying to get a visa application for those of us who are non-immigrants, or for those of us who are immigrants trying to immigrate to the United States, and now to have this additional policy framework to determine what it is that will now be a part of our assessment or eligibility conditions. Now, previously, the United States visa application mainly screened for communicable diseases, like the tuberculosis, the measles, COVID, those kind of conditions. But now that chronic diseases are being added to the mix, such as or diabetics or obesity or heart conditions, some cases even mental health conditions, then there has to be some kind of no new consideration that will be put into the mix when it comes to assessing an applicant by a visa officer. Now, the reason that they have given as to why this is now a new condition that is now being explicitly mentioned is because in a lot of instances, whether it be these chronic conditions, however they are distilled or however they are within our community, they often tend to have a public burden on the public purse of the country that has a large amount of its population who are suffering from these chronic and progressive diseases. So when it comes to a visa application or immigration status, then this will now be something that US immigration officers will now need to focus in, because it is now something that will drain their public purse, right? So the fact that there is now a guidance to visas officers to ask, applicants to now furnish and declare their status when it comes to these chronic and progressive conditions has to be alarming for the GLP-1 community. And not so much GLP-1 community in and of itself in isolation, but persons who need to have this disease under control so that they may fall outside of this policy framework, given that the GLP-1 medications are assisting to control these chronic conditions. No, it is stemming, of course, on the fact that one of the things that is surrounding and driving this policy is the consideration as to whether or not the applicant has adequate financial resources to cover the cost of his or her care throughout the entire life expectancy. And this is in keeping with doing so without seeking public assistance or public funding, as I would have mentioned, taking it from the purse of the public source. Now, it lets you to wonder. Obviously, we know who will be affected when it comes to this, and it is primarily those who are either applying for a non-immigrant visa or persons who are applying for an immigrant status, whether it be permanent residency, etc. And then to look at how these long-term care will now affect the public and put the general public at risk. So while there is no automatic denial, not saying that this is where the policy is being driven from or the directive that the visa officers have been given, of course it will be something that has to have some discretionary elements surrounding it. And that is why the importance of the GLP-1 medication now becomes of importance. Because for a lot of us within the community, having control over our obesity, having control over our diabetic status, which then could potentially give us other progressive conditions such as heart failure, high cholesterol issues. These are things that we know for a fact have been controlled by these GLP-1 medications. So while the policy or the directive to the visa officers is not a strict and automatic denial, and the fact that there is a discretionary element that the visa officers are now asked to employ, then it is clear the importance now that one must place on controlling these chronic and progressive conditions with the use of these GLP-1 medications. So, as I said, the directive is one that discretion will be applied. So, having one of these conditions won't definitely guarantee you a denial, right? Because assessment is going to be done given the totality of the circumstances, the severity of the condition, the expected treatment and costs, the applicant's resource or dependency, the level of employment, and the level of capacity that is there. But what is certainly important for us to zoom in on as a part of this community and as a part of this um, treatment that we have clearly seen has assisted many of us is to utilize these drugs in such a way that we fall within that bracket or that sphere of persons who they will now have that discretionary consideration to apply for. Now, the policy shift is clearly one that it in of itself cannot operate in a vacuum. It cannot operate just in isolation of applying the fairness concept and the concept of natural justice, right? So, is there cause for concern? Absolutely. Is there cause for corrective measures? Absolutely. Now, it is for us to look at where we are in terms of our condition and seeing what treatments are out there. And of course, I'm going to advocate for GLP-1s to help us control these conditions so that if and when the policy becomes a live policy, we are within the discretionary category of persons that they will not apply an automatic refusal for, right? So the conditions like obesity and diabetes are clearly globally prevalent, and they're driven and influenced by so many socioeconomic factors that discrimination has to, although we would not want it to, some amount of discrimination will apply. Some amount of it will apply, right? And what we want to do in this application is to see how best we can discourage a lot of these policies from being just a one size fit all kind of a thing, right? And that is why I thought hearing this coming up in the space was something that I thought was very important for me to bring to you, right? But I'm sure when we think of how this could possibly be applicable, they're they're going to have to look at, you know, the impact of it, what will be considered as these diseases, and what will guide them into determining obesity levels or diabetic status levels, and maybe redefining what that looks like so that it will be more applicable and not just generalized. And then it brings us to look at things such as appeals, waivers, what will be in place, once this thing becomes a real and live issue. If an individual is so denied, whether for immigrant status or a visa and a non-immigrant visa application, will that applicant be able to contest or provide some form of documentation, whether it be a medical profile, some source of funding, some insurance control measures or um, alleviation to mitigate them being prejudiced, right? So it is important for us to, again, I always say within our community, stay abreast of what you're hearing and what you're seeing, so that you can approach these policy shifts with as much information as is possible, right? So, what are some of the things that you can do or you might want to do if it is relevant? Is that if you or someone you know is applying for a US visa or otherwise, and they are a part of this chronic and progressive um, community, then what you may want to start doing is to gather in your medical documentations, current diagnosis, the treatment plans that you're potentially looking into, what the prognosis is, what is the cost of care, right? Having something to prove your evidence of control and stability of the condition that you have. Provide insurance coverage or personal financial capacity to cover the care. Any form of documentation that will assist when that discretionary element is going to be pulled on, or when it is that these visa officers will need to apply discretion, and you know being able to support your application with some form of evidence. So it may take us a little bit more in terms of the application and submission that we're going to be making, but my advice to you is, with knowledge there is power, and gathering these things together at the very onset cannot harm, it can only help. So it seems to be something, my extraordinaires, that is, it's new and it's an evolving policy area. So I would also say, in addition to gathering the information that I've just outlined for you, I would say seek the advice and counsel of an immigration officer or an attorney who is up to date with the health-based inadmissibility and the public charge that is surrounding this new policy. And make sure that you yourself clearly understand which category you may fall in so that you know what applies to you based on your conditions, right? It is it is something that is troubling for me because, as I mentioned, the numbers that are indicating the amount of persons who are diabetic or obese is more than 50% of the world's population. So, to have a policy in place that could potentially restrict you on the basis of something that it's you don't know who will or won't get it. That's just the reality. A lot of these conditions are um, DNA related. They're part of our DNA by our family history. And to be put in a position where you can't change what is happening to you. You can't change the fact that you're obese because your hormones are just not normal. You can't change the fact that you have a heart condition because you've inherited this from your lineage. You can't change the fact that you're a diabetic because it is passing to you from your DNA centuries ago, but yet still something that is out of your control is being controlled by others. So, as I always say, 90% of what happens to you is what you are able to do. 10% of what happens is what you can't control. So for that 90% of what happens to you that you can't control, control it. And my advice to you is to do so with the treatments that are available within this GLP-1 community to assist us in controlling these conditions that are 10% outside of our control. So guys, if this topic resonated with you in any way, as it did with me when I read it, I ask you to consider sharing, subscribing, liking, turning on your notification bells, commenting, of course, because it is important for us to understand the guidance that is needed at this time. With so much happening within the world and so much happening within our little community, it is very important for us to realize that knowledge is power. And sometimes we miss the mainstream media of it all. And sometimes this is where we come to get our little nuggets and our little information to guide us in our decisioning. So I thank you for taking the time to listen. I appreciate any action that you take to get this out there. So thank you for watching and stay tuned to Conversations with Shelly, where I intend to always take you beyond the ordinary. Be good.